You've survived 5.5 years of heavy textbooks, crowded wards, and almost zero sleep. Now you face the NEET PG grind. Everyone around you, parents, professors, peers, is pushing the exact same narrative. Get the highest rank possible and buy the most competitive branch available. But a top percentile score does not dictate what you will actually enjoy doing every single day for the next 40 years. Picking a medical specialty is not a reward for high test scores. It is signing a permanent, binding contract for your future lifestyle. India's private healthcare market is rapidly expanding, so financial success is achievable across almost any discipline. The real dilemma is deciding how you want to balance clinical adrenaline, societal prestige, and long-term sustainability. To make that choice, we have to look past the entrance exam hype and examine the daily reality of the work itself. Preventing mid-career burnout requires matching your personal temperament to the specific demands of a specialty. Let's look at this quadrant chart comparing revenue potential against work-life balance. First up are the doctors who prioritize predictable hours and a life outside the hospital wards. Getting here requires top-tier entrance ranks, and in the case of radiology, massive multi-crore capital investments for MRI and CT setups. The return on that investment is steep. You are looking at a revenue range of 40 to 200 lakhs per annum, with virtually zero midnight emergency calls. The hidden cost is stepping away from traditional bedside life-saving. You will spend your days in a dark reading room or catering heavily to an urban cosmetic clientele. Securing that level of wealth and peace of mind means letting go of the frontline healer identity. Then there are the adrenaline seekers, the doctors who want to stand at the absolute top of the medical hierarchy. Reaching this tier demands brutal years of extra training, like a DM after your MD, and immense physical stamina to endure long procedures. The payoff is unmatched societal respect and the highest revenue ceilings in medicine, scaling up to 500 lakhs a year. But the lifestyle penalty is severe. You will face chronic stress, unpredictable emergency calls, and heavily compromised family time. These fields offer massive glory and financial reward, but they demand a literal physical sacrifice of your youth and personal health to get there. Next are the clinical purists, those drawn to complex diagnostic puzzles and deep, long-term bonds with their patients. The daily reality here means managing overwhelming patient volumes and carrying a heavy emotional load. You get universal, steady demand, deep job satisfaction, and a direct pathway into super specialties like gastroenterology. You will still deal with frequent night duties, and the pay can feel moderate compared to the sheer volume of patients you see daily. This path belongs to those who view medicine as an intellectual calling rather than a pure business game. Finally, there are those who actively choose to step away from the chaos of acute medicine altogether. This is a shift toward highly analytical laboratory work or emotionally complex, slow-paced consultations. The trade-offs involve navigating societal stigmas around mental health, slower patient turnover, and in the case of pathology, almost zero direct patient contact. What these fields lack in adrenaline spikes or massive peak revenue, they make up for by offering a highly sustainable, burnout-resistant career marathon. Let's clear up a common misconception. You do not need a top-tier entrance rank branch to generate serious wealth in India. In a rapidly expanding private market, hitting revenues over 10 lakhs a month is achievable in almost any specialty. Reaching those numbers requires strategic location planning, aggressive reputation building, and sharp business acumen. Ultimately, your own entrepreneurial drive will dictate your financial ceiling far more than the specific degree printed on your wall. Weigh your decision across 4 metrics: passion, scope, revenue, and lifestyle. For wealth and sleep, radiology or dermatology. For prestige and action, surgery or cardiology. Traditional healers fit general medicine and pediatrics. For peace of mind, psychiatry and pathology. There is no objectively wrong branch in medicine. True success is simply choosing the specialty whose worst days and biggest downsides you can comfortably live with for the rest of your life.